I am just so pleased and proud to be here today working with the University of Sydney and our other partners. I think days like this are important because it's a format to bring together so many different stakeholders. And I think within health, we often forget who the stakeholders are. I think also in health, we often forget the lived experience. And to see today so many people with a lived experience of mental health issues, and indeed those that have had to care for people with mental health issues, I think it's great to bring us all together. I think today will be the start of a journey, not necessarily the end. And I would hope that following this, that we can start to evolve better systems and modelling for not just mental health in youth and young people, but across the health system itself.
Lived experience is one of the most important pieces of this process because there's so much that we're missing in our data collection, in our service delivery, in our commissioning models at the moment because lived experience hasn't been a part of that. And I think that's what's meant to differentiate this project from other approaches and tools that we've developed in the past, is that we've got those direct experiences of this regional system, and that's feeding into the model at this stage in the process. It's not coming in later, it's not coming in afterwards, it's coming in now. I think that the approach to co-design here has been incredibly authentic and genuine, and that's incredibly important for a successful product at the end of it, is that everyone feels like they're involved, feels like everything that they say is directly feeding into it. And so even if we can't have a perfect ratio of stakeholders or everyone's available on the same time at the same place, what we develop is still going to be authentic and genuine and true.
So excited to be here at Workshop 3 to come back and showcase the hard work that we've all collectively done in building this model and in bringing together best available research evidence with best available data and importantly local knowledge to build this interactive decision support tool that can really help to make a change in the region and understand what impacts we could possibly have with smart investments.
No, I think it's just been a wonderful process, and I think the partnerships has just highlighted how successful this model design has been. So we've been so fortunate to have amazing partnerships with our service providers and our lived experience representatives to be able to feed into the process to make sure that it is really reflective of the Brisbane South population and their needs.
At first I kind of was very sceptical about how the actual process would work and the objectives of the actual project. So it's been very good to see the development of the project as it's gone along and kind of looking at the objectives and the data sources and the assumptions around the modelling itself and being able to contribute that too, and the transparency around that's actually been really positive.
We're coming at it from different elements, but again also the common goal and having a tool that we can all use to support each other, and sometimes that is useful if you're putting it up through different pathways, different policy, different language, but if people see commonalities, they go, these people are integrating, collaborating, and we're not going to be doing things in parallel and in silos.
I think the most interesting thing about the final product that's been developed is how everyone responds to it. You know, just seeing how people's internal worldview, I guess, of what they thought the system was like, and then actually seeing what's effective and maybe what's less effective, how things affect the whole population. And then sitting there with the lived experience representatives and seeing how they're responding to it and seeing how much actually aligns so well with their experience of the system, I think has been the most satisfying part of it.
In the journey to now, in the processes that we've had to put in place, you don't sort of have a picture of, so what is this tool actually able to do? And so when you can get in and have hands-on, it's kind of that wow moment. It's like, oh my goodness, this can really do a whole heap of different things that we've never seen before. So to me, it has a sense of adding a sophistication to our planning processes to, again, improve our system and its impact on not only individuals who access services, but upon the well-being of the whole population.
It was really fulfilling. But besides being such a heavy topic to try and cover, and because after the first session we saw so many things that contributed to the mental well-being of young people, I guess it leaves me hopeful to see how the tool will help everybody in future.
My biggest hope after this whole massive project with all of these stakeholders is wrapped up is that everyone stays engaged, that we really work together and keep this energy to keep the model up to date, and that everyone continues to use it, not just in their planning processes, but just across the board, you know, if they're considering whether or not something's going to work, whether or not they should be having it for young people, ensuring that they're using this model, that they're consulting with their community, and that they're really checking all the way through that what they're doing is effective and has a lot of decision making to back that up.